So, sir, how old were you when you had your valve surgery?
I was 74.
74. And how old are you now?
I'll be 77 in a couple of months.
Great. So, firstly, you look incredible. And this is important because, it shows that when you're in your 70s and even sometimes in your 80s, if heart surgery is the right option for you, you can get through it, get on back with your normal quality of life, and do very well. But this is a great example of how technology has advanced so much in the last few years that now, and this has changed from maybe even 3 or 4 years ago due to many trials and studies that have come out. But if we take a normal, 74-year-old that comes in with just a tight aortic valve now, as things stand, the typical approach for that valve will be to go in through the leg. And we've learned this through studies, whereas for decades it was going through the chest, and surgeons will sometimes go through these tiny incisions that may often just be here, sometimes here. Now, the typical way in someone in their 70s is to come in, go through the leg. And I will tell you a bit about this procedure because it's been such I would use the word mind-blowing advance in the treatment of valve disease that it's normal now. And, I've done a couple of these today. And let me tell you what a patient would typically happen to them. So you'll have a patient, they'll come in, they'll have a workup and they'll lay on the table and be completely awake. This is someone often in their 70s. And through a small incision in the groin, we'll go up, we'll place a valve while the patient is awake but having some sedation to keep them very comfortable. And then under the X-ray, just like doing a stent in the heart, we'll go and place a valve in the heart. The procedure could last about 20 to 30 minutes. And that patient will have their valve replaced and be sitting up within a few hours' time, walking the same day. And I will tell you, we have sent patients home the same day, and routinely the next day. And this is so incredible. If you had told me, and I'm a valve specialist, but if you had told me 10 years ago, hey, you're going to send someone home, I'd say, I don't even know what you're talking about. And now it is routine and expectation for someone that comes in, valve through the leg, home the same, or the next day, sometimes the day after. And this can be done with excellent longevity rates. These valves are lasting longer and longer. And it's basically seen as an equivalence to the surgery. And so that field has night and day flipped around even in the last 2 or 3 years. I would think if you were to, and you obviously had a wonderful surgery, and don't get me wrong, there's times in people's 70s where they need to have their chest cracked open, and the heart team, which is the surgeons, the interventionalists, the structural heart specialists, we say, someone like myself, will get together and say, this is what we think is best for you. But now those teams are moving more and more in the right scenario to say the right valve for you is to go through your leg, replace that valve. And we're just seeing amazing results from this, and patients just doing so well.
I mean, that's just so amazing. What's
cool.
this? What is this surgery called?
It's called the Tavr, and it's the Tavr, T-A-V-R. Now, I tell you, I'm in the South, and every now and then I hear someone call it the Tavr, but I'm going to call it Tavr, which is transcatheter aortic valve replacement. And this is a surgery, to put it in context that people would understand. A famous musician, Mick Jagger, he had this surgery, and he had his aortic valve done, and was up and honestly back living normal life and going on tour shortly afterwards like nothing happened.